Hello friends, welcome to our YouTube channel, Gajpal A-Learning. In this video we are going to study about posology, part of pharmaceutics part 1. Topics covered in this video is definition of posology, factors affecting posology, and pediatrics dose calculation based on age, body weight and body surface area. First let's know what does posology means. Posology is a branch of pharmacology that deals with the determination of the appropriate dosage and administration of medications or drugs for individual patients. It involves studying the factors that influence drug dosage, such as age, weight, medical condition, and other relevant patient characteristics. The goal of posology is to ensure that patients receive the correct amount of medication, optimizing its effectiveness while minimizing the risk of adverse effects. Healthcare professionals, such as doctors and pharmacists, use posology principles to prescribe and dispense medications safely and accurately. Factor affecting posology. Posology takes into account various factors that can influence the appropriate dosage and administration of medications for individual patients. Some of the key factors affecting posology include: first, age. Age plays a significant role in determining drug dosage. Children and the elderly may require adjusted dosages due to differences in metabolism and sensitivity to medications. Second, weight. Body weight is an essential consideration for drug dosing, especially for drugs with weight-based dosing recommendations. Third, renal function. Patients with impaired kidney function may require dosage adjustments, as their ability to excrete drugs from the body may be compromised. Fourth, liver function. Liver impairment can affect drug metabolism and clearance, necessitating dosage modifications for certain medications. Fifth, gender. In some cases, gender differences can influence drug response, leading to different dosing requirements. Sixth, disease or medical condition. The presence of certain medical conditions may require dose adjustments or the avoidance of specific medications altogether. Seventh, concurrent medications. Drug interactions can occur when multiple medications are taken simultaneously, leading to changes in drug effectiveness and safety. Eighth, genetic factors. Genetic variations can impact drug metabolism and response, leading to personalized dosage recommendations in pharmacogenomics. Ninth, pregnancy and lactation. Pregnant or breastfeeding women may need adjusted dosages, as some drugs can cross the placenta or transfer into breast milk. 10th, route of administration. Different routes of drug administration, e.g., oral, intravenous, topical, can impact drug absorption and distribution, influencing the required dosage. 11th, frequency of administration. Some medications are administered multiple times a day, while others may have a sustained-release formulation, affecting the total daily dosage. 12th, desired therapeutic outcome. The severity of the condition being treated and the desired therapeutic effect may dictate the appropriate dosage of the medication. It is important for healthcare professionals to carefully assess these factors and consider each patient's unique characteristics when determining the most suitable drug dosage for safe and effective treatment. Now, pediatric dose calculation based on age, body weight, and body surface area. Pediatric dose calculation involves careful consideration of a child's age, body weight, and body surface area, BSA, to determine the appropriate dosage of medication. Different drugs may require specific dosing methods, and it is crucial to follow guidelines provided by healthcare professionals and drug manufacturers. Here are some common methods for calculating pediatric drug doses. First, age-based dosing. Age-based dosing involves prescribing medication based on the child's age group. For instance, certain drugs may be recommended for children aged 2 to 6 years, while others are more suitable for those aged 6 to 12 years. The dosages are usually predetermined and listed in pediatric drug references. Second, weight-based dosing. Weight-based dosing adjusts the medication dosage according to the child's body weight. The prescribed dose is typically specified as milligrams, mg, per kilogram, kg, of body weight. For example, if the recommended dose is 10 milligrams per kilogram, a child weighing 20 kilograms would receive 200 milligrams of the medication. Third, body surface area, BSA-based dosing. BSA-based dosing takes into account the child's body surface area, which is calculated using formulas like the Mosteller formula or the Dubois and Dubois formula. Once the BSA is determined, the medication dosage is prescribed per square meter, m², of BSA. Formula to calculate body surface area based dosing. First, Mosteller formula for BSA calculation. BSA, m² equals height in centimeter into weight in kilogram divided by 3600. Second, Dubois and Dubois formula for BSA calculation. BSA, m² equals 0.007184 into height in cm, 0.725x, weight in kilogram, 0.425. Note, the caret symbol indicates an exponent or power. For example, x 0.725 means the height raised to the power of 0.725. 4. Combination of weight and BSA. Some medications may use a combination of weight and BSA to determine the appropriate dosage. It is essential to use appropriate pediatric references and consult with healthcare professionals, such as pediatricians or pharmacists, when calculating pediatric drug doses. Dosing in children requires precision and accuracy to ensure safe and effective treatment while minimizing the risk of adverse effects. Moreover, healthcare providers must also consider the child's specific medical condition and any potential drug interactions before prescribing any medication. Example: let's consider a hypothetical medication called pediatricosine, prescribed for a 5-year-old child weighing 18 kilograms and having a height of 110 centimeters. First, age-based dosing. Age-based dosing may specify a certain range of ages for which the medication is appropriate. Let's say the recommended dosage of pediatricosine for children aged 2 to 6 years is 50 milligrams. Second, weight-based dosing. For weight-based dosing, let's assume the recommended dosage of pediatricosine is 5 mg per kilogram. The child's weight is 18 kilograms. Weight-based dose equals 5 milligrams per kilogram by 18 kilograms equals 90 milligrams. Third, body surface area, BSA-based dosing. To calculate the BSA using the Mosteller formula, BSA equals height in centimeter into weight in kilogram per 3600. Now putting the values, BSA equals 110 centimeters into 18 kilograms divided by 3600. Now BSA equals 0.55 square meters. Assuming the BSA-based dosage of pediatricosine is 30 milligrams per square meter. BSA-based dose equals 30 milligrams per square meter into 0.55 square meters. This gives BSA equals 16.5 milligrams. Fourth, combination of weight and BSA. In some cases, a combination of weight and BSA may be used. For instance, the prescriber might decide to use 60% weight-based dose and 40% BSA-based dose. So let's see, weight-based dose equals 60% of 90 milligrams. This gives 54 milligrams. And BSA-based dose equals 40% of 16.5 milligrams. This gives 6.6 milligrams. Now total combined dose equals 54 milligrams plus 6.6 milligrams. Which gives the final dose. That is 60.6 milligrams. Note here the 90 milligrams and 16.5 are the values which we have calculated previously. In this example, we have calculated the pediatric dose of pediatricosine for a 5-year-old child using different methods. The actual dosing method used in clinical practice will depend on the specific drug and its recommended dosing guidelines. Healthcare professionals will also take into account the child's medical condition and any potential drug interactions to ensure safe and effective treatment. It is essential to follow the recommendations of the child's healthcare provider and use appropriate pediatric drug references when calculating pediatric drug doses. Thanks for watching this video.